All right, everyone, looks like we've got a few more joining. We're going to go ahead and get started. So again, this is Jesse Liston with Healthiest You. Want to thank you very much for your time this morning. Also, we want to thank you for an awesome 2015. We've got some great partnerships out there, and I hope you all experienced some great success, as I know we did. It's been a really exciting time, especially that Q4 timeframe that everyone maybe dreads a little bit, but at the same time really enjoys because of the exciting atmosphere and then the constant busyness. But again, thank you all so much for your partnership and the time again today. So, we all know Healthiest You. Main goal, right, is we want to reduce the health plan claims that are hitting the health plan for the simple things, right? So we're gonna take and redirect those, steer them over to Healthiest You. Now, our topic today, of course, is Healthiest You versus the embedded offering, right? And what are those differences? So here's what we're going to discuss. We'll start first with Healthiest You. We'll give you all a quick product rundown. I know some of you have seen that before, but it's always a good refresher. And then we're really going to dive into how we're changing behavior. Because in the end, that's what it's all about. And we learned through failings that having telehealth, although it's an awesome benefit, and you have access to doctors 24/7, 365, but just having that and having the access to that is not enough. And we found that everyone's a creature of habit. We're all guilty of that. We need to educate, right? Help them understand what they have. And there's a vast difference between what we're doing as far as a platform designed to redirect claims, simplify healthcare, versus having just access to healthcare, and then the engagement, the education that goes along with that to ensure that the product is indeed a success. So first, let's start with the state of telehealth, and I'm sure you've all seen this. Deloitte released this study, and they were projecting about 800,000 e-visits in 2015, which I think the industry came awfully close. Within a few years, they're projecting about 300 million e-visits. So kudos to you, because you're probably seeing that, right? Healthcare is moving towards a more convenient option, a more affordable option, for multiple reasons. We've got a shortage of physicians out there in the country. So oftentimes, if you have something simple, you can't just jump to a primary care physician. You're having to rely upon a more costly urgent care or emergency room. Many other factors, trying to get to those care points, especially if you're in a rural area, the time it takes to get to those points, even if you're in a city, all these things can vary. But ultimately, the industry is moving towards it needs telehealth in order to service everybody, right? To give everybody the care that they need. So what we've done with our platform is taken telehealth, which is just a piece of what we do, but we've got other things wrapped around telehealth. Now, why do we do that? This is a good first piece to talk about us versus an embedded carrier model. You need to engage people for more reasons than just telehealth. Now, our client success team, that's the pivotal piece. We're going to touch on that. But once they get the word out there, how do we get people coming back to Healthiest You for things beyond just I'm sick and I need to talk to a doctor? So what you're going to see today, and we're going to demo some pretty fun new features for you, is of course we have telehealth access, a prescription savings tool, right? You can shop and price out procedures. You can check a deductible balance, a summary of benefits, view some wellness content, and also find providers in your area, and even search for those in your network as well. What that does is it simplifies the experience, and really we're just connectors. We're connecting the member to the type of care they need, steering them down the most efficient path possible. A great analogy would be, I like the Uber analogy personally. Uber doesn't own a vehicle, right? All 1099 employees, they simply have developed an app that simplifies the experience of connecting you, the member of Healthiest You, to a doctor or to your deductible balance, right? So it's the same thought as they're connecting you to a driver in a car. We're connecting you to the different pieces of your healthcare. It's extremely user-friendly. What we mean by that is we have companies, for example, manufacturing company that's hit over 100% utilization every year. They've never really advertised their smartphone app. Their population's more of a, we just need an 800 number, right? They're not big on technology. That's just fine. We will find a way to get the word out there. Of course, if you have a lot of those folks now that have, the smartphone app, the smartwatch, tablet, even pretty soon smart TV, all of that then can be used to access Healthiest You, and again, keep the benefit top of mind. In case you all haven't seen this, and I know some of you have, but this is a really important stat. And the studies vary, but between 70 to 78% of all of the reasons you visit an office in person, they can safely and effectively be handled right over the phone. So our goal is to take as much of that 70% as possible, redirect it over to Healthiest You. And it really comes down to what results are your clients looking for. So again, let's touch on embedded. All right, so we've got a embedded telehealth solution. It's bundled in or part of, say, a fully insured carrier plan package, right? If your clients are, let's keep it conservative. Say that, we know the average family of 4 visits a doctor 12.3 times per year. So let's just say, okay, if 4 of those visits per year could be redirected to Healthiest You, well, how many of those would you want redirected? The answer is generally going to be, well, I'd like 4 redirected. That's awesome. 4 redirections per family would be an extremely awesome result. Now, if you're looking at an embedded model, even if they say like 1 redirected, the embedded model as a whole will see less than 1% utilization in a year. So as an example, I've got 100 employee lives, right? All of the employees, family members have access to this embedded telehealth solution. They may get 1 consult for that group through the entire calendar year. Now, why is that? Well, a lot of it's due to the fact that it's not marketed too much. It's not changing behavior. We're going to touch on that some more. But again, think about the results they want and why Healthiest You is going to be a better option. Top 9 reasons for an ER visit, nearly identical to our top 9 diagnoses. And I'm sure you all see the one common factor here. They're all acute illnesses, right? Something requiring amoxicillin, penicillin, maybe a Z-Pak. And we market it pretty simply. It's a really simple message when you boil it down. Fundamentally, we probably all understand and believe that it's more affordable to call a doctor versus going to the doctor in person. For all these reasons, right? You're not sitting in a room with other sick people. Our primary plan is a no consult fee option, and we'll touch on that later, but that's a few different reasons for that. You don't have to travel anywhere, and I can tell you that I've got 2 kids, and the fact that I don't have to strap them in car seats at 1 o'clock at night is really, really handy. No claim against the plan. So if you work with level-funded or self-funded groups, that's an awesome thing to help them save some money. And also, their employees save time, and for many different reasons. And it's available 24/7, 365. For some reason, if we can't help you, then go and access the more costly care options because you have to, right? But we want everyone to start with Healthiest You for anything that's not an emergency need. We have the largest telehealth network in the country, and you'll get questions around the doctor network. All of our doctors are licensed and residing here in the U.S., board certified, following NCQA credentialing. Big mix, right? So we've got a different mix of ER docs, primary care, pediatricians, general practice, ear, nose, throat, you name it. You've got it across the spectrum. Some of our doctors practice in office and take consults when they're not in the office. Others are full-time practicing telehealth only. And like I said, we've got a nice mix there. But again, it's available 24/7, 365. We are ramping up video technology, so we're looking at being back in Idaho here fairly soon. Arkansas, they're moving towards telehealth again. They had a law in place, if you get the question. The law in place was written well before telehealth was becoming more mainstream, and it's prevented telehealth from being there. So the state is moving back towards telehealth. We think it won't be long before telehealth is there as well, meaning we'll be in all 50 states again. Let's hit on the member experience. Different ways you can connect with us. And what we're finding is to our smartphone app, a lot of our consults are coming from that for those that have downloaded it thus far. So they download the app and they like to go back to the app and request a consult. But you can actually do it a few different ways. So through our new member portal, which we're going to run through today, you may request a consult there. You may do it through our smartphone app or by simply dialing our 800 number, right? Pretty basic, very, very easy. What that does is it will actually call your phone. It'll dial you on your cell phone, and then you're in touch with our customer care line representative. You can think of them as being similar to somebody that works at the front desk of a doctor office in person. So they're there to gather basic symptom information, help you complete your health history if you haven't done so. They'll confirm what state you're calling from. They'll also confirm that you're a Healthiest You member. Now, then a call scheduled with the doctor licensed in the state that you're calling from. On average in 9 minutes, 30% of the time in under 2 minutes, that doctor calls you back, and they'll walk you through a consultation over the phone. At the end of that consultation, if a prescription is needed, that is sent via e-script to your choice of pharmacy. And it's pretty convenient in that if I happen to, maybe my preferred pharmacy is something that's not open 24/7 and I needed a prescription at night, the doctor can help me find a pharmacy in my area that's open 24 hours a day. So that can be moved around fairly easily. Almost every pharmacy will take an e-script nowadays. almost every pharmacy. It's pretty rare that you won't find one. So at the end of the consult now, my prescription's been sent. My electronic medical record's been updated with the consultation notes. If I'd like, I can request that those notes are shared with my primary care physician. And then those notes are also stored in the member portal. So at any time, if I'd like to see those, I jump back into the member portal and I can take a look. So there are some really important stats on this page, and I think the first one is by far the most important. As an industry, we're seeing customer satisfaction at 97%. If that's the case, why aren't more people using it as an industry, right? We know people love it when they use it, but what's stopping them? Well, it comes down to our engagement strategy, and we're going to touch on that. But when we saw that number, we immediately said, we've just got to get people to try it one time, because when they do, they're hooked, and they'll use it again and again. They'll tell their coworkers about it. That has a positive impact on everybody. We're going to do that some more, but that's a big one. Large majority of our calls are resolved in one phone call, but there are 6% where the member's calling for something outside the scope of what we can do, and they're referred to an in-office visit. Average consult time, 13 minutes. Retention's extremely high right now because clients are using it, right? They're seeing high utilization, having great results. The employees love it. It's the one thing they do not want to get rid of. The one thing on this page that's also really important, especially if you're selling, for all groups it's important, but if you're looking at a fully insured plan where, we're really more there for easier access to care, and it's very, very affordable versus the employees, say, on a high deductible plan that's paying, $125 to $150 for a PCP visit because they have pink eye, right? Or they're going to an urgent care and spending over $200. Where with Healthiest You, it's free, less the prescription, right? Much better option. But in addition to that, 50% of our consultations will result in the employee not having to leave work for care. So we will have an impact on reduced absenteeism or increased productivity, depending on how you look at it, but it will impact that positively as well. And I can speak to that myself. I've had many times where my children were sick, one or both, and I'm calling at night. We're able to get taken care of at night, and they're going to school or daycare the next day, and I'm able to go to work. So it will have a nice impact there. All right, let's focus on the big one. This really is the difference between, well, us and all providers, but if you think about the embedded model, extreme difference between an embedded model. Education, reminding the member they have it, and then simplifying the process when they get there. It's everything. We want you to know that you've got Healthiest You. We want you to know what it is. So when we roll out a group, we're going to help them understand it by sharing what we call a quick start guide for every employee to see. Here's what the benefit is. Here's where you go to get started. Download our smartphone app. That's just the beginning. We follow up with a fulfillment kit, right? So you receive a member card, you receive a one-page flyer outlining again what Healthiest You is, where to go get started, what the service offers, and so on. We remind them through geo-fencing alerts. I'm sure you've all seen that, and at least some of you on the call have, where when I have my Healthiest You app on my phone and I walk into an urgent care, I get a push reminder stating, hey, remember, you've got Healthiest You. It appears you're at an urgent care, but you can request a consult right now over your phone. And you can avoid sitting in that room with other sick people, right? Paying a lot more money for care, spending so much more time, and so on. We'll also remind them through what we call retargeting. So you'll see banner ads. If any of you have been to our partner portal yet or our corporate site, you probably shortly thereafter saw a Healthiest You banner ad on your browser. That's called retargeting. So we're catching somebody. We're going to keep it top of mind. If you're a broker or if you're any type of partner or a member, we want you to be thinking about Healthiest You. And then we simplify the process. I got to tell you that there are features on the way that are going to make it so easy, and your members are going to love it. But we can't get into that today. But what I will tell you is we want to make it easy. A big reason why those embedded models have no utilization is even for the few people that know that they have a telehealth solution in there, when they go to use it, it's pretty bulky, and on top of that, they're usually paying anywhere from $40 to $50 on the side of a consultation fee. So it's a barrier. I mean, we're all creatures of habit. We touched on that earlier. It's part of our routine. We get sick. We want to go to an urgent care, right? We want to go to an ER, unfortunately. Well, now I have Healthiest You, where it's free. That's an easier decision to make. When I'm going to use that telehealth option and I'm having to pay a $40 copay, I've just put up a barrier, and that member is pretty unlikely to use that service the first time because it's new to them, right? They don't understand it. They don't know if it's going to work. And now their thought is, well, I can pay $40 for a telehealth consultation that I know nothing about, or I could call and the doctor might say, we can't help you, or I can pay $150 to go to my PCP or a little more to go to an urgent care. They'll go to the urgent care more often than not. A large majority will go to an urgent care. All right, so we've always touched on our app, but I'm going to show you something new today. I want to touch on our member portal. Our new and improved member portal. But before we get there, I'm going to jump through a few of these. The reason that we get utilization is because of our client success team, and I can't stress this enough. You'll run into clients that, maybe we don't connect with the carrier they work with. So we're going to touch on some of these, but for example, maybe we don't have a connection to a TPA they use. So we can't show them a deductible balance. Right? We can't map out their network. That's a small piece of the pie. The biggest piece is our client success team. You've seen our utilization numbers, right? We showed you in 2014, average utilization was around 42%. That was before the smartphone app launched. So what does that tell you? Client success is the pivotal piece to the puzzle. Without this, we're not going to see utilization, right? We just won't. That's one thing that the embedded model does not have. It's someone reaching out to your clients. Hey, I see that you've elected this plan. Did you know you also have this telehealth option? That doesn't exist, right? There's no education. They may get a flyer in the mail with a member card. Most people think it's junk mail. They throw it away, right? For the people that may say, hey, this looks kind of cool, and then they see there's a $40 charge, they throw it away. It's all leading to that 1% utilization. It becomes more, it's more of you have access to it at that point in time, but it doesn't have an impact on the plan. It doesn't have an impact on anybody's access to care. It's literally a checkbox benefit that just sits idle. Client success is everything. So when you get the group that says, well, you don't connect to my TPA, I don't think this is right for us. That's okay. It's not the important part is client success. The reason we have different tools in our app, and our CEO, Jim Prendergast, said it best the other day, we're building a better mousetrap, right? If we have 4% of the population that may come in there to check a deductible balance, that's 4% of people that maybe we wouldn't have gotten before, right? If 5% are interested in wellness, or if 5% want to search for a provider, that's more, right? It's a mousetrap, but it's not the end-all be-all. The client success team, the education process, this is by far the most important piece of what we're doing. All right, let's touch on some of the new stuff here. Bear with me, I'm just going to find where my member, here we go, member portal. All right, we just launched the member portal on this last Monday. And really you can think of this as it's our smartphone app, but merchandise for a bigger screen. Our dev team has done a fantastic job on it. The one thing, of course, it doesn't do is Geo-Fencing Reminders, which we're going to touch on for those of you that haven't seen that before. But this is a great tool, really easy to access, easy to navigate, and so on. So the dashboard will show you, your current weather forecast. Always, again, fun quote, something educational, some wellness content available below, latest news in healthcare if you're really into that. You can request a consult right from the dashboard. So here I am. I can hit start consult, calls my phone number, and I'm rocking and rolling, right? Very easy to use. You've also got shortcuts to provider locator tools, prescription pricing, shopping procedures. So let's locate a provider. Let's use an example of, let's say our pediatrician just retired, right? I need to find a pediatrician that's top rated, that's in my area. So let's go 10 miles, that's my zip code, find providers. Now it's going to populate the top rated pediatricians that are in that area. And I can take a look at who we have. All right, so I've got a really nice list here of different pediatricians around me, right? Now some of these folks will have multiple practices, so you might see some things that look like it's not a pediatrician. It is, they just have different practices around the area. But it's a great way to find providers and then look up some information on them as well. If we go back to the Today page, let's try to set a prescription. Now the smartphone app, I would say, is probably the most convenient for this tool. And I say that because we can load the coupon right to, I know Passbook for iPhone, I know Android devices have something similar. And in this case, let's use the area I'm in now, which is 85255, 5 miles around, compare prices, look up amoxicillin. I think the big hook for our prescription drug pricing tool is, previously we'd always stated, right, 70% of the time we'll beat the average copay. I bet you it's higher now just because most plans are moving towards some type of high deductible option, right, where I'm out of pocket a lot more for either doctor visits or on the pharmacy side. But you can see here, all right, Fry's for food and drugs. That's a grocery store / pharmacy in Arizona. 816. I click on Get Card. I can actually add it still to my Passbook, right? Or I can just save this. It's very straightforward and easy. Smartphone app's probably getting better. The only difference here is now I can also see locations on a map around me, which is great. Easy to use, right? You can switch different forms of a pill, dosages, quantities, and so on. Very simple. All right, back to today. The other one, shortcut to shop procedures. The procedure pricing tool it's extremely valuable. You just have to understand how to use it. Extremely valuable. So we have a third party that aggregates all of this data from different providers around you of that specific procedure. And let's say, as an example, I need to have an MRI done on my brain. And first, I'm thinking about paying cash. So let's look up what the average cost is on a cash basis for an MRI in my area. I'm going to get pricing. Now, importantly, this won't be right to the penny. This is a cost estimator. But I can tell you now, looking at this is actual data. So in this zip code, in my area, right, all of the providers of an MRI for the brain in 85255, the lowest cost on a cash basis was $300 around here. The highest, $1,083, and average paid $852. So now I have an idea of what I should be spending if I elect to pay cash for this procedure in my area, right? I know that $852 is about average. If I shop around, I might find it as low as $300, but I should make some phone calls because I can save myself some time and save myself some money as well. Now, let's use an insurance option. Same thing, MRI, fine procedures, little different because this sorts by CPT codes. You can look up virtually anything. And I had the question the other day, well, I looked this up, it didn't have any results. Well, depending on your area, there may not be a provider of that procedure in your zip code. So if you ever see no results, that's why. It could be more in a rural area, or you just need to expand your search a little bit more. But here's our brain MRI. So some interesting data. I already know it's going to come up, of course. I've cheated and looked this up before. If I use insurance around here, now my deductible balance is high. I'm on a high deductible plan. And if I use insurance in this zip code, I'm actually going to save myself about $300 right in that area. Sorry, I may have lost my connection for a second, but I'll talk you through this. So I can save myself $300. Now I know that for me, I'm better off using insurance in this situation rather than using a cash option. Now I was just in Florida about a week and a half ago, and I did the same thing there, and completely different as far as results go. I was able to find that same procedure in Florida, but it was cheaper to pay cash rather than use insurance. So it's very, very regional. What you'll find is it's a regional thing. It all depends on where you live. What is the cost for elites in that area? How strong are the network discounts and so on. On that insurance option, it won't show me the cost based on my specific insurance plan. That's aggregating all of the network discounts in my area, right? So you can think about, maybe I have 5 or 6 carriers around me here. It's really averaging out their network discount and showing me that it would be around $550. But again, it's valuable information because generally for me a cash option is better because I'm on a high deductible plan. But in Arizona, even though I'm on a high deductible plan, the network discounts are strong enough. I'm better off using the network discount versus going in person. All right, let's jump back to the PowerPoint deck here, and I'm gonna jump around on you all just a little bit. We're gonna scoot back up. All right, Geo-Fencing Reminders. So we mentioned these before. I just want to give you all a preview. This is the urgent care reminder. So I walk into an urgent care. I have the Healthiest You smartphone app. I get to that urgent care. I'm reminded that I can call Healthiest You, right? Versus sitting there waiting. Now, what's interesting about this is, the member may not call Healthiest You, right? They're already there. Maybe they brought the kids with, and it's 2 in the morning, and they just want to get it all taken care of, right? They've gone through the car seats, waking them up. They've had enough. That's okay. It's all about behavior change. At this point in time, we're getting you in the habit of starting with Healthiest You, and our benefit reminders are designed to do just that. We just want you to simply start with Healthiest You. We do the same thing for a pharmacy. So using a pharmacy, right? I go to a pharmacy, I'm shopping for a prescription more than likely, and when I get there, I am shown another reminder that says, hey, remember, you've got Healthiest You. You can price out prescriptions, and we'll beat the copay about 70% of the time. Okay, great. I'm thinking about Healthiest You. And people say, well, what if they go to a grocery store that has a pharmacy? They're not there for a prescription. That's okay. It's about behavior change, right? We're just catching somebody, kind of giving them a, hey, we're here, we're ready for you. At any time, these alerts can be turned off, but it's all about behavior change. That's the pivotal piece. Now, we've touched on utilization, and let's dig in just a little bit deeper. So utilization in our industry, how is that measured? It's measured a little uniquely, but if you have, again, 100 employee lives as an example, 100 employees plus family members have access to the telehealth benefit that you have, right? You take the number of consultations over the entire year and divide it by the number of employee lives. So if you're looking at an embedded model, they're going to see about 1% utilization, one consult out of 100, right? We've seen the competitors range. I've seen anywhere from 1 to 5%, some go up to 8%, some might sneak up closer to 10%. It's pretty amazing if they can get to that point without a client success team helping drive that message home. It really is. Our average, again, we sit around 42%. Self-funded groups tend to be higher, mostly because they understand the more they blow that horn, the more money that they save, right? Pretty simple concept. But our goal is to get them to use the heck out of it, right? When you all sell a Healthiest You client, right, we're working together on that case. We want you to look good. We want their utilization to be as high as possible. Now, we've had groups that may start out, 10% their first year, 15%, and you may think, that's not the result we're looking for. But here's what you have to think about. It's behavior change. It's about a 3-year plan. So if your group starts out at 15% year 1 and you're feeling like, well, this maybe isn't working, what will happen in year 2 is that utilization doubles. And it doubles for a couple of reasons. One is 97% satisfaction, right? I may have used it the first time towards the end of the plan year and I loved it. So what does that mean next year? I'm probably going to use it once or twice, right? Maybe more depending if I have a bigger family. The other thing that happens is when I use it, I'm sharing stories with my HR team. I'm sharing stories with my coworkers. I'm doing word-of-mouth advertising, which we all know is probably the best type of advertising you can have. And in addition, our client success team continues to drive home Healthiest You through different forums, different mediums, right? Marketing it in different ways, spreading the word. That results in about a double in their utilization year 2. So now your 15% you didn't feel great about turns into 30. Now I'm feeling better, right? Well, guess what happens in year 3? It doubles again. Usually we'll go anywhere from 50 to 60%, that same group. So now all of a sudden we are looking really, really good. So just think about that. Don't get discouraged if you have a group that starts out slow year 1, right? It's going to take time, but what do we all know? This is going to get bigger and bigger, right? We saw the article in the beginning, the study from Deloitte, 300 million e-visits. So what that means is it's going to happen. They're going to have it eventually. The sooner they can get in the habit of having it, the better for that client, because it will be there. At some point, everybody's going to have it. So let's get them in the process, get them in the habit much earlier than we would have before. All right, sample fulfillment, just to take a look at that. We might change this a little bit, but our fulfillment kits, really, really importantly, only serve as a reminder that the member has Healthiest You. So, we'll get emails, well, when do their member cards arrive? It's so different than insurance. You don't have a member ID. That number on the card, randomly generated. It's not tied to you. There's nothing significant about it. It's just there for looks, honestly, to fill the white space. Because if it wasn't there, that card may look a little bit blank, right? That's all it is. But we're reminding you that you have the benefit. So this will arrive about 1 to 2 weeks after the group's effective date because it's a reminder. Our initial piece is we send an email to the HR team that includes a quick start guide. That quick start guide is a PDF document to be shared with the employees that get Healthiest You. That is the first point of contact. We verify membership using last name, using birth date, using zip code. Pretty simple, right? Off the primary member. You don't need a member ID for us. It's so much easier than that. This is just a reminder. You've got Healthiest You. And oh, that's right. Yeah, I saw that email. I can put the card in my wallet as a reminder. I can put the flyer on my fridge, but I know that I've got Healthiest You. Some different pieces of marketing. I love this side. This is retargeting. I mentioned that earlier. And you can see there, Healthiest You members can, and it's rolling through every single piece of our offering. Different ways we're engaging with the members. But the retargeting is great. People get impressed by that. They leave a website and all of a sudden see Healthiest You again. Oh, that's right. I've got the Healthiest You benefit. I was in the member portal 3 weeks ago, whatever the time frame is. We've also done a lot of cool pieces around different seasons. So allergy season's a big one, right? We'll have some allergy season items going on because I can tell you it's in full bloom in Arizona. Back to school is probably one of my favorites. A cute kid has picking his nose, but it says, pick Healthiest You first, right? We want people to giggle when they see our marketing pieces. We want them to look at it. My personal opinion, I think a lot of benefits in the world, they aren't that exciting, right? I mean, they're not. You can't market too much when they've got disability insurance or something along those lines. But Healthiest You, we can have a lot of fun with it. We want to catch their attention, get them using it. So what you'll see from us is marketing that's very, very exciting, entertaining, attention-grabbing. All right, let's jump into a few different cases. These are real cases with Healthiest You. First one, some of you may have seen this, but a lot of your clients are moving towards a high deductible plan because the cost of any other type of plan is becoming too expensive. and it's tough. And when they do that, the employees are thinking, oh man, I'm out of pocket now up to $2,500, $5,000, whatever it is. They're out of pocket for pretty much everything unless if something bad happens, right? Well, it's a great time to plug in Healthiest You. I myself am on a high deductible HSA plan. I haven't touched the plan. I call for everything, right? Now, obviously, I may need to take a well visit, which I haven't done in a while, and that's my fault. But you get the idea. For all of these simple things where, I think about a kid's got pink eye. I can't get to an urgent care. I have to go to an emergency room. I'm going to pay about $400 for that visit because I'm on a high deductible plan. I have Healthiest You. It doesn't cost me anything. All I'm paying for is eye drops. It's unbelievable. You're going to pay for way more than the cost of Healthiest You in a year. You think about an employer-paid plan, 2 to 99 employee lives. Each employee costs $108 a year. So you've paid for Healthiest You 3 times if you would have had to go to an emergency room for pink eye. It's perfect. And if the company doesn't have enough money to put it in there, then offer it on a voluntary basis and educate the employees. Let them know, look, you use this one time, you paid for it. You have to have it. It's not you need it. You have to have it. It's instrumental. There's no way around it, or else they're going to be spending a fortune. And why? When they could call a doctor, right, over the phone and get taken care of. So much easier. Awesome case study on a bigger group. So Slinger School District in Wisconsin. Current client of ours, they had such great success that actually the superintendent of the school district reached out to us and said, look what happened. I can't thank you enough. We want to share this story with everybody. They loved it. And now, to be fair, they really, really worked with our client success team to push utilization. First year, they hit over 86%. That is awesome. That may be the highest first year, that I've ever seen since I've been here. But that's what happens when you get the word out there, right? You're changing behavior. They show the teachers, all the staff, faculty members, look, call the doctor first. Save the company money. Save yourselves money. Now what happened in their renewal? 2% drop in their renewal. First time that had happened in years, and for the first time in years, because of that, they were able to give the teachers and staff a raise. First time in years. This is the impact it can have. If you're self-funded or level-funded plans don't have this, they're really missing out, because this can only have a positive impact on what's happening. Another success story, bigger group, self-funded again, 2,210 employee lives. They were having a very difficult time with urgent care spend. As a matter of fact, the urgent care spend was so bad that they decided to change the plan, but the key piece to that, they put Healthiest You up front. Because again, the employees are going to see a plan change, and you can see here the urgent care copay jumped up to $75, deductible jumped up, right? So they're using the plan as a vehicle to make it more consumer driven. And you plug Healthiest You up front, and now they're thinking, all right, I can call a doctor, doesn't cost me anything, or I can go to the urgent care, and now it's costing me $75 a visit. They started to call Healthiest You. First year with us, urgent care spend dropped 37%, right? Redirection of claims saved $214,000, utilization 44%. Awesome results. And they've been doing great ever since. This group has had such great success with Healthiest You. They're actually going to give every employee Healthiest You this plan year, which ends up being over 5,000 people, right? But that's what happens. Now, if you're on the fully insured side, you've probably heard this before. It's all in the plan design. No, I think naturally plans are moving towards a high deductible regardless of how you're designing them. Your options are becoming more limited as the designer of that plan. But when that's happening, when they're moving from what used to be a copay plan where the employees felt like they had some help to consumer-driven, high deductible, HSA, HRA, you're out of pocket, then you start with Healthiest You. We can handle 70% of your needs over the phone. You do not need a rich major medical plan. You just simply do not. We can do the majority. Then you use the major med for the 30%. And you can plug in, supplemental ancillary financial products depending on what your specialty is and what the group needs. But if you do this right, you can save the plan enough money. You can use the savings to pay for Healthiest You and then also sell more products. And in the end, it's going to help your commission out, right? Because you're making commission on multiple products versus just one, right? Or just two. You can get more in there. And not only that, now the employees are happy because doctors are waiting on them. They're not waiting on doctors. They're not out of pocket for strep throat. They're not out of pocket for ear infection, allergies, right? We all get it. It's so helpful. Boosts morale, keeps employees at work, saves the plan money, saves the employees money. Broker makes more money. Broker has stickier business. Everybody wins in that scenario. Can't be beat. Now, Healthiest You sits in a lot of different things. Obviously, any plan type. It could be a high deductible plan on the fully insured, could be a self-funded. I'm sure some of you on the call sell All Savers. That's a level funded. And I want to touch on All Savers first. You may all be thinking, well, isn't Healthiest You embedded in All Savers, right? Isn't it just part of it, similar to any other carrier model? It is. But what's different about it? We treat every single group like a standalone client. So every group gets a phone call from us. We host weekly webinars for All Savers groups. We will host different marketing campaigns for All Savers groups because, again, it's about changing behavior. So we are not a checkbox benefit. We're driving utilization. So, again, very, very different model than a traditional, we're embedded checkbox. It's there, but nobody knows they have it. We want you to start with Healthiest You. So for those of you that have sold All Savers plans and are selling them now, it's a completely different approach. Healthiest You is on every one of those with you. Want to make sure that that's a success because it's going to have a great impact on that plan in many different ways. MEC plans are growing in popularity, and we're in a lot of MEC plans now. It's a great tool. Again, access to care because those plans are a little skinny. But you get the idea. It's going to have a fit nearly everywhere. These are our rates. So you'll see different rates. The top is employer paid. Employer paid rates are by far our most popular. The employer paid model is something that is probably 99% of our business. But that's the model that has grown exponentially. It just makes a lot of sense. If they're having to skinny the plan, they're still willing to pay for Healthiest You, for all the reasons we've discussed. It is also sold on a voluntary basis. So if you are selling to individuals, and I know you all probably went through a crazy open enrollment, session here just recently, but a lot of the individuals nowadays, they're buying high deductible plans. Those individual plans, if they're not high deductible, are very costly. It's a great time to add in Healthiest You, extremely affordable for that individual. It makes perfect sense with the plan. Now that we have a little more time, I want to roll everybody through our smartphone app, right? So bear with me just for a moment. We're going to demo that for you in case you all haven't seen it. And we're going to touch on a couple of things here. And that's going to be assuming I can get my technology to connect here for me, so bear with me just a moment. Now, if you all haven't seen the smartphone app, it's not the end-all be-all, but what a fantastic way to keep people engaged, right? To increase awareness, help them understand what Healthiest You is, that they have the option, and so on. I can't get it to connect, I apologize. Let me jump back to this deck here. The one thing we didn't touch on is Radar. And Radar is the other component that's great. So on the desktop version, it's bigger. It's easier to see. But using Radar, you can find different points of care in your area, and those will range from doctor offices, urgent cares, hospitals, pharmacies, and even veterinarians. You can sort that map by specialty. So if you're looking for a pediatrician in our earlier example, you can actually have the map just populate pediatricians in your area. Now, if we sync with your plan, and with most we do, we sync with about 180 plans, payers, and TPAs, you can also sort that by network. So if I'm looking for, here's an example. I'm not by my house. I'm with my family. Say we're camping. We're 2 hours away. Someone gets sick. Beyond the scope of telehealth, we need to find an urgent care. I have no clue what's around me. I can jump on Radar, see a real-time map of my location. I can sort for just urgent cares in network with 90% accuracy. Now, we are not trying to be a provider search company or a provider directory, but it's an awesome way to keep people engaged. So the carriers will have the most accurate list if you go into a carrier site, but we've simplified it. It's a heck of a lot easier to find that through the Healthiest You smartphone app or through our member portal. We do it a little bit differently. We map it out by which payer is paying which provider, right? So there's about a 3-month delay when doing that. That's why it's not 100% accurate. But keep in mind, nothing is 100% accurate. So there's still it's a great option. And every time somebody goes in, they'll see a disclaimer that says, be sure you call to confirm that they are indeed in your network still, right? Call that location to make sure. We'll send that every time to our members to make sure they remember that, okay, that's right, I've got to do that. So if you're worried about somebody calling and then it's not in network, we do have a disclaimer up there, and we all know that problem will always happen because people are people, they follow a routine, and they're going to forget to ask, and that'll happen from time to time. That's okay. But that's really the last piece of the puzzle. And then one more I want to show you all is we've got a great new client portal, if you haven't seen it. And so you don't get dizzy, let me pause my screen and jump over there. And the client portal helps people see where they stand. So this is a case of ours, and if you want to look at their plan year 2015, they can pull this up on their own at any time. So they can jump in here and they'll see what their year-to-date utilization was. So this is not plan year, this is calendar year. So for the year 2015, they have 2,547 employees, did 1,296 consults, 45% utilization, self-funded group, they had awesome results. Redirection up top. So if you have, again, for anybody, this is important data. I don't care if you're fully insured, self-funded, level-funded. They'll see this and understand how they're impacting the plan depending on what plan they have. So if they're self-funded, it's great, of course. The employee's access to care is huge to see how much time they've saved and so on. So every time someone calls Healthiest You, they're asked, what would you have done if you didn't have Healthiest You? Would you have gone to an urgent care, a primary care, an emergency room, or done nothing at all? So we'll take that data and then specific to the client, share with them their results, right? Their survey results from their employees. So in this situation, we know which claims are redirected. Now, if we scoot down just a little bit, we're going to get a bigger picture. Now, this is a multi-site group, so they can see which state is having the best success, which is great because, you may have to have a different marketing strategy depending on where you're located, right? Every state's going to be a little bit unique, the employees will be different and so on. So they'll understand, all right, if Texas is having the most success, well, what are they doing? Are they doing something different? How can we help our other locations? Time of day is a big one. So when the members are calling, what time are they calling, right? And what we see generally is from 6 p.m. to 10 or 6 p.m. to 6 a.m. That's usually the bulk. You see there 61%. So oftentimes people are calling at night when their only option is an urgent care or an emergency room. Then you have 35% late afternoon and not very many in the morning. It's a pretty interesting stat. But you get an idea now of how that's impacting the reduced absenteeism, right? Increased productivity. People are calling at night or later in the evening, they're able to go to work the next day instead of waiting and then having to schedule an appointment and then wait for that appointment probably a day or two if they already have a PCP, a relationship established. If they don't, on average, they're waiting 19 days. It's not even an option. They have to go to an urgent care or an ER or just work really sick and hope it solves itself, right? Top 5 complaints. So if the group wants an idea of, what sicknesses are happening, it's right there. Now, we've had the question a lot, can you report data back on all of their consultations? Because we want to manage the health of the population. We're taking care of, right, the simpler things, right, acute illnesses. So that data is really more speaking to chronic care. That's the costly, right? How many people have diabetes? How many people, have other issues? This data is not really going to impact that, right? You've got a snapshot here, but it's not like, we're going to solve diabetes and save the company a lot of money. That's not what we do. Well, of course, no one can, but you'll get the idea. That's not the data that's really going to help. That's not our specialty. Our specialty is the acute care, the simple things. You also see the top 5 prescriptions, and as you can see there, amoxicillin, Z-Paks are the top 2. That's a lot of it, right? Plan savings. This is a great one. Again, if I'm self-funded, I want to see this. Now, these numbers are extremely, extremely conservative. Primary care is more now around the 150 area. Urgent care is more 2 to 250, and we're seeing ER is about 1,400. But again, we're giving them an idea of what they're saving, because if you're a self-funded group, you're actually creating an ROI by promoting Healthiest You with our assistance. And another one to point out, if you've all looked at, what is the potential ROI for a self-funded case I'm working on? You can think about it this way. We had a payer partner of ours do a study, and they pulled every CPT code that we could handle out of their big bucket, and they averaged the cost per visit. That average cost per visit came out to $291. So anytime someone would call Healthiest You, instead of going in person for those CPT codes we could handle, it saved the plan $291. Now, I always think of it as self-funded clients will generally have some type of copay in there. It could be $40, could be $50, whatever it is. So to keep it conservative, you can just knock the copay off and say, all right, that gets us to $230, right? $240. Now, when we're in that area, the utilization we need to hit for that group to make the benefit cost neutral or actually create an ROI for them ends up being anywhere from 15 to 20%. And even if they have a lower amount, the real PEPM is really low too, right? If you're starting at, say, $6 or $7, you can chop that in half pretty quickly. That is a really affordable benefit. So self-funded clients, for lack of a better term, it's really a no-brainer. It can only be a positive result when you're affecting their bottom line. Level funded is really similar. You can keep claims out of the plan, and I know many different level funded plans are different, but maybe it eliminates an increase in their costs for year 2 at the renewal time, or it puts a cap on it. Obviously, a lot of times the employees or the company can earn some money back, maybe in an HSA account or just a direct credit if they need to have care down the road that's taken care of. So all good things on that side. So let's jump back over to the deck here. All right. See if we've missed anything today. I don't think we have. So again, the embedded model, and we're going to open it up for questions after this, but the embedded model lacks everything right here. There's no education. Now there may be a little bit, to be fair, I shouldn't say none. There's a small amount, and it's usually on about page 40 of their benefit handbook, right? It's hidden fairly well. Not that that's a purposeful thing, it's usually tiny, and there's about a paragraph where no one's going to get there. So the education is lacking. There is no client success team, right? You don't have a team of people calling these groups saying, hey, you've got this benefit. Make sure you utilize this. How can we help you get the word out? How can we help your employees? Can we host a webinar? Can we do some marketing campaigns? Can we do a smartphone app, right? It doesn't exist. So you've lost the education. No engagement, right? We're not catching anyone at their time of need. The employees get a flyer usually in the mail once a year that they don't know what it is. They throw it away. And, okay, we've lost engagement. So ultimately, we're not redirecting, we're not steering claims away from the plan, right? We're more or less doing nothing. We're not having an impact. It really comes down to it's more of access at that point. So I hope this is really helpful, and I'm sure you're all going to see more and more that you'll be selling against embedded plans, and all I can tell you is we win deals against them all the time. It's just a matter of walk that group through a demo. So, use our team, right? We like to help with those client demos. Use us. Let us help you walk them through a PowerPoint. It's a quick thing. We can do it in about 20 to 25 minutes. We'll keep it real high level. Just give them an understanding of what we do that's different, right? What does the client success team do? How are we changing behavior? You're going to win deals all the time against the embedded model. We see it again and again because we are just a completely different model versus something that's buried into a health plan. All right, so I've got a couple of questions here. And this is a good time, so if you all have any, throw them out. We'll get to as many as we can, and if I don't answer them all, what we'll do is we'll reach out to you, and we'll have somebody from our broker support team reach out. So, question about the PowerPoint today. We will actually send you all a copy of the recorded, presentation today, and we're finalizing a new PowerPoint deck for you. Once that's finalized, it'll actually be in your partner portal. So at any time, you can jump in there and we have a lot of great marketing pieces there, your enrollment forms, PowerPoints, many different tools to help you out. And we'll be happy to give you a hand. If you can't find that, please let me know. But you will all get a recording, even if someone just registered to get a recording today. All right, I got a question. What about California? I don't know if you're referring to prescriptions, but I see another one right below that about Kaiser. So great question there. If you're in California, we cannot send an e-script to a Kaiser pharmacy, because as we all know, if you're familiar with Kaiser, you have to go to a Kaiser physician for a prescription to be sent to a Kaiser pharmacy. But what we can do is just send it to another pharmacy around. Now, can they use their plan? No, they can't, right? It's going to be a cash option, but keep in mind we're thinking about the simple things, lower cost medications like amoxicillin, right? It's not going to be a big hit to the member, still much more affordable than having to go in person. Another question around where in the application can members switch to Spanish. Right now, there aren't Spanish-speaking capabilities to our smartphone app, as far as the app goes. But when the member calls Healthiest You, so for those folks, they can even just keep an 800 number handy, or if they know enough just to get to request consult, as far as their language barrier goes. When they call, they just simply, they say right when someone answers, I need someone that speaks Spanish, and we'll get somebody on the phone that speaks Spanish. That's available 24/7, 365, and Spanish-speaking physicians are available as well. Had another question on, the procedure pricing is great, but can you tell us where those prices are? It is a lot of data. It's a lot of data. So we're going to be working on that. I'd say that's going to be well down the road, but for now, it's just at least good for the members to know, here's what it should cost me, right? Think again, it's more of a cost estimator, but now they understand that they can call around. Consumer driven, right? Help them become educated and understand how that works. Next question, how do the reminders appear through the app? Is it a text message? It's a good question. It's what's called a push notification. So it almost pops up like an alert on your smartphone. And it'll pop up when you're there. So if you're at the urgent care or the pharmacy, an alert pops up. We call it a benefit reminder alert. And it's triggered by your location. So think about a virtual boundary surrounding, say, the urgent care you're going to or the pharmacy. Once your phone with GPS functionality crosses that virtual boundary, within about a minute to two, it triggers that benefit reminder alert right to that member, helps them. Oh, that's right. I've got Healthiest You. All right, let me check all that here. So a question around, how do they check vitals in conjunction with your condition? If they have to check vitals, so blood pressure, right, pulse, that's beyond telehealth. So if somebody's calling for something along those lines, they'll get referred to an in-office visit. We can't check vitals over the phone. There aren't tools available. I think down the road everything will be in your house, but for now, not there yet. I had a question around people on Medicare. We can help people on Medicare. As a matter of fact, our app syncs with Medicare. So if they have Medicare plans, they can use our smartphone app for a lot of things. But keep in mind, our product isn't an insurance product. It can sit alongside of anything, really, anything at all. Let's see other questions we have here. How do we deal with a population that's used to just going to an emergency room? And it's behavior change, right? It's all about behavior change. And the first piece of something like that, education. We've got to get them educated, help them to understand that they've got Healthiest You. They can start with Healthiest You. If it's not an emergency, they should go there every single time, right? That's the big one. But I had another question I think is pretty interesting. How can you pay doctors with such small fees? That's an awesome question. You know, for us, we know where we need to be able to get utilization and still not have to close our doors, right? But you lead me into an interesting one. We talked earlier about what are we looking for as far as results go. And oftentimes you'll be up against maybe another plan that's sitting in there at, $1 PPM unlimited use, and the group is thinking, this is a good deal. $1 PPM, and they can call the doctor as often as they want. This is fantastic. Well, there's always fine print. The first fine print would be if you hit, X% utilization, usually it's like 5 to 10, either the rates go up or we can cancel you at any time. That's what we've seen with competitors. But then you got to think about the group. Okay, what results are they looking for? Let's use, again, 100 employee lives as an example. If we know out of the 100 employees, we'll get 4 visits per year. How many of those visits do they want redirected? They say 1. All right, so you want 100 consultations. That's awesome. If I've got $1 PPM for 100 employees, right? I've got $1,200 in the bank that I can provide consults for, and if you say that the doctor calls maybe $50 a pop, I'm not going to be covering many consults, and I'm sure as heck not going to cover 100, or the business would be bankrupt pretty quickly. So in our space, just to put it very simply, the rates, the utilization is in the rates. And if you see a really low price point, that means they are not going to get a lot in the way of results as far as utilization on the telehealth side goes. That's an awesome question. We get it all the time. And then you also have to think about, all right, if they're not going to get much utilization, they can come in at a low price point. That also probably means they're not engaging their members at all because they don't want them to use it. They're not built for utilization. Doesn't make the company bad. It's more access. It's very similar to an embedded telehealth model. So great question, and it's always a good question to ask. All right, we had a question around chronic condition management. I don't see anything soon. I really don't. That's beyond what we're doing. It could be something down the road. We never say never, but nothing in the pipeline for now as far as chronic condition goes. All right, well, thanks so much for your questions. We really appreciate, again, the time today. And again, we'll send everyone a recording of this webinar. Should be out there fairly soon. If you need anything, please give us a call. We're always happy to help. Remember to use us for webinars. We love to assist with employer webinars. We are on your team. We want you to grow your business. We want you to be better, more successful, and we're here to help. So thanks again, everybody, for your time. We appreciate it. Enjoy the rest of your week and weekend.